Hello and welcome to Medical Dialogues. I'm Roshneeta. Let's look at today's top health highlights. Every inpatient fall cannot be considered result of malpractice unless caused by medical negligence. Commission absolves Indraprastha Apollo Hospital. Holding that every fall cannot be considered a result of malpractice unless it was caused by medical negligence, the Delhi State Consumer Disputes Redressal Commission has adjunked a complaint against Indraprastha Apollo Hospital, Sarita Vihar, alleging medical negligence in handling a patient of Metastatic Hilar Cholangiocarcinoma with dislodged PTBD who fell from the hospital bed and eventually died. Justice Sangeeta Dhingra Sehgal, Pinky and J.P. Agarwal clarified that to constitute a fall injury in a medical facility, the fall must have been the result of a medical provider failure in providing an acceptable level of care. In the instance care, medical record suggested that the patient was immediately attended to after the fall and all necessary actions were taken, but if the patient did not survive, the blame cannot be passed on to the hospital and the medical staff provided all possible treatments within their means and capacity, the court further said. The case revolves around a patient who suffered a fall while in the care of the hospital, subsequently leading to their death. The patient's family filed a complaint alleging that the hospital's negligence contributed to the fall and the patient's subsequent demise. The hospital responded by stating that the patient's attendant, without waiting for staff assistance, attempted to making the patient sit up, leading to the fall. The hospital also mentioned that the patient had pre-existing health conditions including advanced metastatic cancer and jaundice, which made them prone to bleeding, including intracranial bleeding. The hospital further argued that they provided necessary education on fall prevention and implemented safety measures such as bed rails and skull bells. In its observation, the Commission acknowledged that the patient's family had been educated on fall prevention modules and there was no substantial proof to suggest that certain documents were fabricated. The Commission also noted that the patient's medical condition and treatment options were complex due to the advanced stage of the disease. The Commission later clarified that not every fall in a medical facility can be attributed to medical negligence. The Commission ultimately dismissed the complaint, stating that the hospital had provided reasonable care and attention to the patient and the unfortunate death might not necessarily indicate medical negligence. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.